Hi, I'm Dr. Katrina Donahue, family physician, professor at UNC Chapel Hill.
And I'm Dr. Laura Young. I'm an endocrinologist at UNC, and we're here today to talk to you about the results of our Monitor blood glucose monitoring trial.
The value of fingerstick blood glucose testing in patients with non-insulin treated type 2 diabetes is debated. There are some studies that have shown improvements in glycemic control, while others have shown no evidence of effect. Despite this, over 75% of patients do home blood glucose monitoring.
It's important to get the answer to this because glucose monitoring requires a lot of patience, and if it's going to help them manage their diabetes better, we definitely want them doing it. But if it makes no difference or it doesn't help them, then we'd like to take one more burden off of them and make it easier to engage in self-care.
So this study was conducted in 450 patients attending primary care practices in North Carolina. These were 15 primary care practices. Patients had type 2 diabetes, not on insulin. Their A1C or glycemic control was between 6.5 and 9.5. We randomized them into 3 groups. The first was no glucose testing or no home self-monitoring. The second was once daily glucose monitoring, and the third was enhanced once daily glucose monitoring, which meant when the patient would test their blood glucose, they would get a message delivered to their meter with encouragement or instruction.
And what's important to note and what makes our study unique is that we actually did this study in the real world setting. We randomized patients and deployed the intervention in the practices where the patients were seeing their doctors on a regular basis. We didn't do it in a clinical trials setting unit. We were in the practices in the real world.
And our primary outcomes, we had 2 of them. The first was glycemic control, or A1C, at 12 months, and the second was health-related quality of life at 12 months.
So the results of our trial found that at the end of 12 months, the glycemic control, or the A1C, which reflects how well a patient's blood sugar has been over the past 3 months, there was no difference in that A1C over the 12-month period, depending on whichever arm they were in it. There was no difference. We also found that there was no difference in health-related quality of life between the 3 different groups at the end of 12 months.
One interesting point was that at 6 months, the A1C levels were lower in our testing groups, but again, at 12 months, the results were not significant. This could have been due to some decreasing compliance in our testing groups.
For me, it definitely raised some questions and was a little surprising. We often think of technology as sort of the next greatest thing, and that will be able to help us as we manage our patients to do better with all of their health conditions, but especially diabetes. And it was surprising that despite all this extra attention and messaging that we gave to the group who got the messages through the glucometer, they did no better compared to the people who were not testing.
Well, first, this study does not include patients on insulin, so it does not apply to patients taking insulin. This study also didn't look at specific situations. It was not geared to look at, for example, testing if you changed your medication, if you increased a dose on a medication, and the study was not powered for subgroups such as duration of diabetes or history of prior glucose monitoring. Assumptions that blood glucose monitoring leads to better health outcomes may not be correct. Glucose monitoring should not be routine. Rather, patients and doctors should discuss each individual situation to decide whether to do home blood glucose monitoring or not.
And one really important takeaway message from this trial is that these patients in the study were not on insulin. And so for folks who are on insulin, blood glucose monitoring still remains a cornerstone of therapy. And for patients who are not on insulin, however, there definitely should be some discussion with the patient and between the patient and the provider about how to proceed and whether glucose monitoring is really an important piece of the care plan for patients without insulin.